The smile of each of the women you see is a great reminder of USAID Voucher Plus activities' journey to end preventable maternal and child deaths.
We know that in Uganda, maternal and child health issues are ranking high, and we are not on a good page internationally as far as maternal mortality, neonatal and child mortality are concerned. And right now, as I talk, the maternal mortality in Uganda stands at 336 deaths per 100,000 live births, which is extremely high if you compare to countries like Japan, where there are only about 2 deaths per 100,000 live births.
The public health sector is inadequately financed to meet its priorities. Access to government-owned health facilities is often difficult due to long distances for some women, inadequate supplies and low staffing levels. Yet, private health facilities are often expensive for the poor to access care. As a result, many poor women deliver at traditional birth attendants and/or in their villages without skilled attendants, leading to many deaths we see today. The government of Uganda recognizes public-private partnerships as an important strategy to strengthen health systems by leveraging the strengths of each sector. USAID partnered with the private sector providers to reach the poor women in need of life-saving interventions like Uganda Voucher Plus activity. The Uganda Voucher Plus activity engaged over 182 private health facilities to deliver a life-saving voucher to poor pregnant women at only 4,000 shillings to access a package of quality maternal and child health services while building capacity of private health actors to implement alternative long-term health financing mechanisms to sustain services for the communities they serve, including the poor.
I was once in Voucher Plus. The day I went in Charis there, a certain woman introduced me to Voucher, and it helped me because by then I had no money. But I went there, introduced me to Voucher. I started antenatal service without paying anything. I only paid 4,000 for the card, and it has really helped me. When time came of labor, I went there. I gave birth to Charity, free of charge. Yeah, everything was free and I was very happy.
One of the over 196,000 women that accessed maternal health services, including a skilled birth using a voucher.
When the program came in, we started experiencing a very, healthy switch in terms of, good relationship with the district. We started receiving a district team coming to give support supervision to the facility, together with the team from the USAID Uganda Voucher Plus activity, coming to do, continuous health education.
And so we are very happy that since USAID Voucher Plus, we have been in partnership with the private healthcare providers, which are being supported to provide maternal and child health service delivery. And so we are now a strong team working together as the district health team and the private for-profit and private not-for-profit healthcare facilities delivering the maternal and child health services to the communities of Lira district.
In terms of building capacity, we have engaged public-private partnerships, strengthened that, made sure that it's functional, where we see a district working together with the private sector, ensuring, for instance, that there's an ambulance available at the private facility for emergency cases, where we have seen the districts supporting the private providers with emergency obstetric care training, where we've seen extend family planning commodities to private sector so that women can easily access a method of their choice, where these districts have also supported the private facility in increasing their skills in HIV prevention and also immunization.
The time the voucher came, we were at 52% deliveries in the facility. And when last financial year we moved to around 67 to 68% supervised facility, supervised delivery in the facility. And this was the great impact that we registered with the Voucher Plus.
When Voucher Plus project came in, they started reporting on MCH. All these other Voucher Plus projects and facilities started reporting on MCH. This greatly helped us to improve on our performances.
As Voucher Plus scales down, district leaders are hopeful that the private facilities are prepared to transition to innovative and cost-effective ways to enable poor pregnant women to continue accessing care when the activity closes.
The issue of cooperatives is going a long way, and for the people at the ground, it's what can really work for them.
Some of the things we have done that we think will live beyond the project have been building capacity of the supported private sector providers to understand and implement alternative long-term health financing mechanisms. As we exit right now, we have supported 42 health facilities that we've been supporting have been enrolled on the current 2 results-based financing mechanisms. We have 37 facilities enrolled under the Uganda Reproductive Maternal Newborn Child Health Improvement Project, Ministry of Health, RBF project, and 5 other providers have been enrolled under the USAID-funded Enable RBF project in Acholi sub-region. We've also trained providers on cooperative health insurance scheme. And among the providers, over the 52 health facilities trained, we have 18 that have taken up this model and at various stages of implementing or setting up this cooperative health insurance scheme.